The normal lifespan of red cells in the peripheral blood is option A 30 days, option B 5 weeks, option C 120 days, option D 2 months. And the answer is option C 120 days. The expected percentage of myeloblast in a normal bone marrow smear is option A 5 to 10 percentage, option B less than 5 percentage, option C 5 to 15 percentage, option D 10 to 15 percentage. And the answer is option B less than 5 percentage. In alkali denaturation method for the determination of HbF, which of the following is not used? Option A hemolysate, option B patient serum, option C acidified 50% saturated solution of ammonium sulfate, option D N/12 NaOH solution. And the answer is option B patient's serum. In pernicious anemia, the MCV is option A increased, option B normal, option C decreased, option D none of the above. And the answer is option A increased. Microcytic anemia may be seen in the following except option A pernicious anemia, option B thalassemia major, option C tropical sprue, option D idiopathic steatorrhea. And the answer is option B thalassemia major. An increased level of plasma hemoglobin and the presence of methalbumin are the signs of option A post-hemorrhagic anemia, option B aplastic anemia, option C increased RBC destruction, option D CML. And the answer is option C increased RBC destruction. Hemolysis is caused by an intracorpuscular defect in all of the following except option A hereditary spherocytosis, option B sickle cell anemia, option C thalassemia, option D paroxysmal cold hemoglobinuria. And the answer is option D paroxysmal cold hemoglobinuria. In beta thalassemia, which of the following hemoglobin is increased? Option A HbA, option B HbS, option C HbF, option D HbD. And the answer is option C HbF. For coagulation and platelet studies, type of blood containers used to prevent contact activation. Option A nitrocellulose, option B aluminized tubes, option C siliconized, option D none of the above. And the answer is option C siliconized. Stability of diluted blood for platelet count is about option A 10 minute, option B 30 minute, option C 1 hour, option D 2 hour. And the answer is option B 30 minute. Normally, the spreader is kept at an angle of option A 50 degree to 30 degree, option B 30 degree to 45 degree, option C 60 degree, option D 60 to 75 degree. And the answer is option B 30 to 45 degree. In the case of severe anemia, spreader slide is kept at option A 30 to 45 degree, option B greater than 60 degree, option C 15 to 30 degree, option D all of the above. And the answer is option B greater than 60 degree. In the case of polycythemia, spreader is kept at option A less than 50 degree, option B 15 to 30 degree, option C 30 to 60 degree, option D greater than 60 degree. And the answer is option A less than 15 degree. Romansky stain is option A compound dye, option B neutral stain, option C both A and B, option C acidic. And the answer is option C both A and B. Fluid part of clotted blood, option A plasma, option B serum, option C lymph, option D pleura. And the answer is option B serum. Fluid part of anticoagulated blood, option A plasma, option B serum, option C saline, option D lymph. And the answer is option A plasma. Fibrinogen is absent in option A plasma, option B serum, option C lymph, option D pleural fluid. And the answer is option B, serum. Reddish color of plasma or serum indicate option A, jaundice, option B, lipemic, option C, hemolysis, option D, none of the above. And the answer is option C, hemolysis. Normal shape of RBC. Option A, spherical, option B, biconvex disc, option C, elliptical, option D, biconcave disc. And the answer is option D, biconcave disc. The tendency of RBC to collect together like piles of coin is option A, aggregation, option B, adhesion, option C, Rulex formation, option D, agglutination. And the answer is option C, Rulex formation.